Bioindex network. Now I request you to address the gallery.
Thank you. Thank you for the introduction. Good morning, everyone. First of all, greetings and to the dignitaries on the dais, especially Dr. Ramesh sir, who has invited me cordially to join the dais with many visionary people. Dr. Kesar sir has very eloquently explained us about the key issues from a common man's perspective. And I hope to look forward to interact with Dr. Kodeshwara sir, Dr. Venkateshwara sir. Also, I really want to thank faculty and members of VIPER and BVRIT who made this conference possible. It's very difficult to arrange this kind of big event with 100+ people. Okay, I myself, during my pharmacy days, I also studied pharmacy at Osmania University College. And to arrange a conference of 50 people, it will be very difficult for us. But imagine this kind of big event. I really appreciate all the efforts of the people working at every level. Yeah, I especially want to give a shout out to the young people over here. Hey guys, hello. Yeah, welcome to the event. I would want to share that there's a very unique opportunity for you to be able to learn about your field from different perspectives, from international speakers, national speakers, from speakers from different fields, management, engineering, AI, programming, and I really encourage you to take full advantage of these kind of events, because in my days when I was doing my bachelor's, we rarely had any events. There was one event back in Delhi which we gathered all the money and went at the end of our 4th year. But thanks to Ramesh sir and others here, you have these kind of events every year. So please take advantage of this opportunity and learn something, and hope you can implement something you learned from this conference in your own life, in your own career. And most important is networking. In my days, I think the networking was the most neglected topic during our education. But when I entered outside the world, outside India, and outside the campus, I think the network is the most important thing. So please feel free to talk to people, to learn something, to have a conversation, to brainstorm, to get some feedback, and hope you learn something, and hope you teach others also some important things. Okay? And without no further ado, I'll take a leave, and I'll see you guys again soon. Thank you.
Our guest of honor today, Dr. K. Koteshwar Rao, sir, graduated from Kasturba Medical College, Manipal in 1966. He was a medical practitioner in UK and worked as an registrar in three different disciplines, orthopedics, surgery, and anesthesia. A varied but a rare experience. Dr. Rao was appointed as the first Indian-born tribunal member in 1985 among the panel of experts by the Lord Chancellor Viscount William Whitelaw of the Privy Council, UK. In recognition of his achievements, Dr. Rao was awarded in 1986 honorary membership of the British Institute of Management. He was a highly successful businessman while in UK, and he founded various healthcare-related businesses during his time in England. While working in UK, Dr. Rao was involved in clinical research and had undertaken several clinical trials on various drugs. Soon after his return back to India, Dr. Rao established one of the first biotech companies in India, Transgen Biotech Limited, which was acknowledged in the annals of Department of Biotechnology as the first company to have brought recombinant technology into India in the form of hepatitis B vaccine. Dr. Rao is instrumental in developing several innovative technologies in the field of biotechnology and received a number of global patents. Now we request Dr. K. Koteshwar Rao to address the meeting.
I'm not sure that I deserve all that, but thank you. almost the last 48 hours. I think. Thank you, sir. With whom we have more than 30 years of association with our company. And of course, Dr. Kesar, your director, who has already covered all the topics in today's conference. I will approach again in the next 2 minutes. And then with what I just met him this morning, Dr. Nikhil Pathak. A lot is waiting for you, Nikhil, in the coming days. Because a lot of challenges that the drug innovation and development is going to depend on your artificial intelligence and dynamics and whatnot. Good morning to you all. It's indeed a privilege to be invited to this institute founded by the most inspirational figure, VIPER Narsapur. As long as this figure stands here, I think it should inspire one and all here. A person with a lot of vision for the future. A person who actually anticipates the development of the world probably for a few decades. We all talk about days and months, whereas he must have actually visualized development for decades to come. And that's what actually transpired today into VIPER or maybe our IT in various names. Aushadh 2K25, bringing together leading experts, researchers, academicians, health professionals, and policymakers from around the world to engage in meaningful discussions and share innovative solutions for pressing challenges, not just in India but across the globe. Drug development is only one aspect, but unfortunately, it is not affordable nor accessible to many. I think that's what the theme of today's and tomorrow's conference is all about. This conference, we should take it as a launch pad for ideas that will shape the mindset of the scholars and industrialists, for discoveries that will rewrite textbooks and for innovation that will redefine what is possible and what is not possible. As far as I am concerned, I don't accept the word not possible. I don't use those two words that tell my scientists all the time. Don't ever come back and tell me that it's not possible, sir. The most complex and difficult solution can be broken down to small fragments. And if you understand the small fragments, how they work, and put them all together, the complex solution becomes so easy to break. That's what innovation is all about. Please don't run away from the failures. Failure is only part of the process of success. It's not an obstacle. Don't ever get disheartened, especially in the process of innovation. It may take 1 month, it may take 1 year, it may take 10 years. And just in our case, one of the technology, it has taken us 22 years to break through. The one that is being talked about. People said that it is not possible to deliver protein by oral route. We have not only delivered oral route, the proteins of different magnitudes and different sizes from 1 kg to 150 kg, but we have proven them all wrong. We could have given up 20 years ago, but we pursued and pursued with perseverance for 23 years. People told me many times, why are you wasting your money and time on this? That's what innovation is all about, and the passion for innovation is all about. We have pursued with perseverance and endured all the challenges and negativities surrounding it. Don't let the negativities influence your mindset. Keep on working, find out where the faults are, correct it and move forward. Because of people like you, the professors and academicians and researchers, we have conquered the diseases, we have split the atom. When I was talking about splitting the atom, that's what I was talking to Nikhil just a few minutes ago. Days are gone when you are talking about reduce the size of the particles for the drug delivery. We are talking about not about the particle sizes. We are talking about how the atoms behave in a particular particle. In the next 5 to 10 years, take it from me, the medical innovation is going to revolutionize when you go down to from micro particles to nanoparticles to femtoparticles into picoparticles. When you talk about atoms, when you talk about how the atomic, subatomic structure of those atoms is going to functional, how you can manipulate the functioning of those atoms for the drug development to be more targeted to each individual cell. We are not talking about anymore about just a kind of organs. We are talking about individual cell that can be targeted into the into the cell and manipulate the functioning of that cell. That's what the people technology is all about. That will be possible with some advancement in the case of nickel and his company. We will work together on that. But what this conference is all about is to stimulate your ideas. Ideas that should generate into what is ultimately a drug development. What is drug development and what is innovation? Unless, and of course, the core theme of this conference is all about affordability and accessibility. Ultimately, unless your drug development has the ability that can be affordable to the ordinary common person, not the rich and the few, select few, but to every common person, every corner of the street. It should be affordable and it should be accessible. If those two ideas are not met, drug innovation shall remain in the labs. Like many of the hundreds of patents that lie in various institutes. And one of the teams I was challenging at one conference to one of the officials of the government in one of them. I said, if all the so-called institutes of excellence are to be measured in the same line as industry, I'm afraid each one of them would have gone to BAFR by now. I'm sure the industry should know what the word of BAFR is. Board for Reconstruction, basic industries. In other words, there's no point in having hundreds and hundreds of publications and patents unless they are put to use for the drug development and for innovation. We should be able to put those ideas and innovation to use, develop the drugs that are not easily affordable and accessible. We stand today at the crossroads in history, a time when innovation is advancing at an unprecedented pace, yet billions still access to life-saving medicines. We are standing at the dawn of a new era, one driven by AI-powered drug discovery, personalized medicine, gene editing, and nanotechnology and picotechnology. But scientific progress must be matched by moral responsibility. A time when we can map the human genome in hours, but today we can do that in a matter of 2 minutes. But diseases like cancer, neurodegenerative diseases like Alzheimer's, Parkinson's, etc., or loss of memory, and rare genetic conditions still devastate the lives. A time when breakthroughs in AI, nanotechnology, and biotechnology promise the impossible, but only if we dare to seize the momentum. This is where our collective responsibility of academicians, researchers, industrialists, and the regulators come into play. It's not enough to innovate. We must ensure that innovation translates into accessible solutions. You must harness the power of collaboration. I think Dr. Kesar has already mentioned about collaboration and already talked about it. Collaboration is a key issue. There's no point in you having innovation in your lab unless it is actually percolating into other parts of the research. We need to collaborate with industries, with the regulators, with the artificial intelligence people tools. All of them put together will only accelerate the development of the whole thing. Now, with a lot of youngsters here and also For innovation, you do not necessarily have to follow the strictly written script. Innovation is all about how to break the script, how to break from the script. It is about curiosity. You remember as a child keeps on asking the mother hundreds of questions. He said, go, it's all their frustration. Don't do that. Innovation is all about like a child asking a lot of curious questions, and you need to be a child. You need to be a child curious enough to understand the complexity of the cell biology. Only then you will be able to devote your time for developing a successful innovation. Some of the greatest breakthroughs in history, whether it is insulin therapy or CRISPR in gene therapy or quantum computing, were all born from minds that refuse to accept the limits. That's why I keep saying break the rules for the right reasons. When penicillin was discovered, it transformed medicine. When mRNA vaccines were created, they have changed the vaccine. The breakthroughs were not accidents. They were the result of relentless innovation, fearless research, and an unshakable belief that science could do better. Bringing a new drug or idea to patient science is a journey fraught with many hurdles and many challenges. I think Dr. Prasad already mentioned about some of those obstacles: scientific, financial, and regulatory issues. It may take anything from 5 to 15 years to develop a drug, and over few hundred crores to innovate one single drug. And I'm sure many of you know that to develop one molecule, 99 molecules fail or 98 molecules fail. Only 2 or 3 may be successful. To achieve faster drug discovery and bring the discovery to the good of society, we already talked about collaborative research is the theme of this moment. Adopt, Sir, and all the current CDSO members and DCJ members, it's our request to simplify the rules and regulations in conducting, whether it's preclinical trials or clinical trials or something else. The rules are far too many and they are much more complex. Even to decipher the language of some of those applications, the more time it takes, even to understand them first. Let's forget about implementation of those. Even to understand those complex regulations itself is getting to be more complex. So let the regulators also think how to really encourage the innovation and move forward. I won't go into nanotechnology because we already discussed about it earlier. The nanotechnology, let us talk just at the moment. Nanotechnology is the one that is revolutionizing drug delivery. Drug delivery not just by alternate route, but also by nanotechnology for injections, for the sustained and prolonged action. Sublingual, oral is all part of drug delivery, new drug delivery, which we are also part of. Imagine a future. Every child diagnosed with chronic illness can receive the treatment they need regardless of their socio-economic background. Picture a world where elderly patients can afford their prescriptions without sacrificing their basic necessities. We must advocate policies that incentivize innovations while also safeguarding the public's access to essential medication. I'm sure, and you all know already, the government of India happily is making certain changes in the regulations to encourage the drug innovation in the United States. We are moving in the right direction there. We must also leverage technology to bridge the gap between the discovery and the delivery. By embracing innovations, we can break down barriers and connect patients with the treatment they need. no matter where they are. Behind every statistic is a story, a mother, a child waiting with hope. We must listen to their voices. We understand their needs and place their experiences at the forefront of our mission. Empathy must drive our innovation. It is a key to ensuring that our solutions are not only effective but also compassionate. A truly great innovation is not one that exists in a lab, one that reaches the people who need it most. That should be our motto also. We are living in a time where innovation is not just an option, it's a necessity. Change the vaccine. And guess what? You are the warriors. The breakthroughs are not accidents in the future. They were the result. You will fight and shall address that necessity effectively. I'm sure of that. It's time to redefine the success in drug development. Success is not just about regulatory approvals or patent or getting a lot of patents or publications. Success is when a mother does not have to choose between feeding a child and affording life-saving medicine. Success is when a treatment for a rare disease reaches every patient, not just those in the wealthy nations. In closing, I urge each of you to join me in this vital mission. Let us be stewards of change. Let us be the advocates of accessibility. Let us be the champions of affordability in drug development. Together, we can create a healthcare landscape where innovation knows no bounds, where every breakthrough translates into tangible benefits for all, and where the promise of a healthier tomorrow becomes a shared reality. Let us use this. Let us rise to this challenge with courage and determination. The future of healthcare is not just a possibility, it is our responsibility together. We can build a world where health equity is the norm, whereby every person everywhere has access to medication that they can change their lives. My challenge to you, here everybody, when you walk out of here, walk out with just more than a degree. Walk out with a mission. Embrace unknown. The greatest discoveries often emerge from uncertainty. Do not fear for the failures. It is not the opposite of success. Failure is not the opposite of success, but a step forward. Every great scientist has faced setbacks, but what set them apart was their perseverance. Thomas Edison once said, I have not failed, but he failed once. I have just found 10,000 ways that won't work. Is that one chance of perseverance in 10,000 more that made what life is all about? The world is built by those who dare to try. Don't run away from the failures, as I said again and again. Dare to experiment, dare to innovate, dare to have something alternative to the failures. Running away is not an alternative that you should ever choose. The leaders are those with courage who stand up when others step back. Never settle since progress is made by pushing the boundaries. Never settle. The future is not written in stone. It is written in discoveries waiting to be made. And most importantly, such discoveries are written by you. So as you step beyond this university case, remember, knowledge is never static. It is continuously evolving. You need to embrace that evolution. Stay curious. The next big breakthrough could start with a question you ask today. Dream big. Don't try to small things. There is nothing wrong in dreaming big. You will achieve it, provided you persevere with it, with hard work. Since your dream is never too big to translate into discovery, the world needs your ideas more than ever now. Go forth with courage and conviction Embrace the challenges that lie ahead and let your passion guide you. The future is not something you inherit, it is something you build. You have the tools, the knowledge and the creative to shape that future. As I saw in the just news bulletin of VIPER, embrace the future, embrace the power within you. You will achieve the success. The future is in your hands. Be the generation that changes everything. Dare to think bigger and dare to push the boundaries of science. Not just for discovery, but for humanity's sake. Now go and make history. The world is watching. The future is calling you. It's yours to create. Dream big and achieve the success. Thank you one and all.
Thank you, sir, for those words of inspiration. Now I am handing you the word.
I request the respected dignitaries on the stage to release this ovarian of abstract in a CD format.
Thank you, sir. Dr. P. Venkateshwarlu, a seasoned pharmaceutical professional, brings a wealth of experience to the table as a retired assistant director from the Telangana Drug Control Administration, now seeking a faculty position. His distinguished career, unpinned by a PhD in pharmacy from Osmania University, encompasses extensive expertise in pharmaceutical regulations, drug enforcement, and compliance. He has held lectures positions at Karnataka B Pharmacy College and Calcutta University, served as drug inspector and assistant director, and contributed significantly as Deputy Director General of India, SEDESCO. Notably, he managed import registrations for cosmetics, facilitated WHO accreditation from Ayush drugs, oversaw narcotics export permissions, and approved blood banks across India. His tenure and assistant director in Telangana involved auditing WHO approvals and licensing drug formulations for over 200 companies in Hyderabad, covering a wide range of pharmaceutical products. Dr. Venkateshwarlu has also played key roles in training pharmacy students, leading professional associations, organizing conferences, and facilitating the separation of state pharmacy councils. He recognized for his contributions, including receiving the Best Pharmacist Award from the Indian Pharmaceutical Association in 2021, and has been a trainer for new drug inspectors and a member of an independent ethics committee. Now, I would like to invite our esteemed chief guest of today's event, Dr. P. Venkateshwarlu, to share a few words with us.
Dignitaries on the dais, and my dear young student friends. This sort of deliberation is must for the pharmacist who is going to do research for a new drugs. course, we are one among them to discover new drugs. That is established. You know the technology, you know the science, you know the pharmacology, you know the disease. But the most famous book that is pharmacology is one which is where you take the Lewis or Adams or one more Goodman and Gilman. The Goodman always say that exact mechanism of action of a drug is not known. So all the times, all the drugs are miraculous. You are supposed to establish the mechanism. It is the duty of one of the duties of our pharmacist friends and research scholars of different faculties, different science branches that are in existence. But here is, there are so many drugs are being now came into our use, but when we see the old drugs, they are all just miraculous drugs, what I feel. Your penicillin, say so many drugs, the olden days. I studied Goodman Gilman 40 years back, where I found to know that mechanism is not known, etiology is not known. So like that, how the drugs have come? How the drugs have come? Today is, yeah, there are a lot of research is going on. As you know that this research is not so simple. It takes time, money, a lot of deliberations has to be done, lot of identification of the heterogeneity of this population, mankind, is the main responsibility of not identifying the drugs so easy. They are making lot of
Exposure. The second prize with an award of 5,000 is awarded to Manognya B from Mallareddy College of Pharmacy. I request Manognya B to come on to the dais. Congratulations, Manognya. Let's give them a good round of applause.
Distinguished guests, colleges and friends, this conference would not have been possible without the vision and dedication of our esteemed leadership and honored principals. We now wish to take a moment to recognize the valuable contributions it's my privilege to invite, whose unwavering guidance has been instrumental, and our respected guests to the stage for a felicitation. Let us extend a warm welcome to them.
I request Dr. Sunita Reddy, Professor of JNTH, to come on to the dais. Welcome, ma'am.
సౌండ్ చిన్న అది పెట్టి సౌండ్ చిన్న అక్కడ సౌండ్ అక్కడ పెట్టి ఇలా కొంచెం తక్కువ తక్కువ
I request Dr. M. Gangaraju, Principal of Gokraju Gangaraju College of Pharmacy. I request Dr. A. Srinivasa Rao, Principal of Bhaskar Pharmacy College, to come on to the dais. I request Dr. Tadikonda Rama Rao, Principal of CMR College of Pharmacy, to come on to the dais. I request Dr. M. Kiran Mai, Principal of St. Paul's College of Pharmacy, to come on to the dais. request Dr. Kantalam Chamkuri, Principal of Brilliant Group of Institute, to come on to the dais. Welcome, sir.
అది ప్లే చేసి
I request Dr. V. Ram Mohan Gupta, Principal of Pullareddy Institute of Pharmacy, to come on to the dais.
సాంగ్ వస్తుందా
I request Dr. K. Hema Malini, Principal of Swami Vivekananda Institute of Pharmaceutical Sciences, to come on to the dais.
ఉన్నది
Welcome, ma'am. I request Dr. R. Narsimha Rao, Professor of Holy Mary Institute of Technology and Sciences, College of Pharmacy, to come on to the dais.
వచ్చినాక వస్తేనే మొత్తం
I request Dr. Ashwini Deshpande, Associate Dean, NIMS School of Pharmacy and Technology Management, come on to the dais. Welcome him, and I request the respected dignitaries on the dais to do the honors. And I request the respected dignitaries on the dais to do the honors. Thank you so much, sir. We are so pleased for your presence today. That's a small token of gratitude from Vishnu Institute of Pharmaceutical Education and Research. Please give them a good round of applause. Now we would like to felicitate our guest of honor, Dr. K. Koteshwar Rao, founder and managing director of Transgene Biotech Limited and Nate Freed Technologies Private Limited. I request the dignitaries on the dais to do the honors. Thank you so much for your presence, sir.
ఇంకొక 40 నిమిషాలు ఒక పీపీటీ ఉంటుంది అయితే అయిపోయి
Now I would like the dignitaries on the dais to felicitate our chief guest of today's program, Dr. P. Venkateshwarlu, distinguished leader and driving force in this pharmaceutical field. Thank you so much for your presence, sir.
కెమెరా గమ్మత్ ఇస్తుంది
Thank you, sir. And now to express our sincere gratitude to everyone who contributed to the success of this event, I would like to invite Mrs. B. Lakshmi Satya to deliver the vote of thanks. Welcome, ma'am.
Good afternoon to all the delegates, dignitaries, principals of various colleges, faculty, and my dear students. Myself, B. Lakshmi Satya, Associate Professor, VIPER, take the privilege of presenting vote of thanks on behalf of Vishnu Institute of Pharmaceutical Education and Research. Firstly, My heartfelt thanks to today's Chief Guest Venkateshwarlu Garu for accepting our invitation and attending and giving his insights to the students. Thank you, sir. I thank today's guest of honor, Koteshwarlu Garu, for gracing the occasion. Thank you, sir. I thank all the esteemed guests of today's event, Nikhil Pathak Garu, Lakshmi Prasad Garu, for gracing the occasion. Thank you, sir. I thank all the faculty from principals from various colleges for gracing the occasion. Thank you. I take the opportunity to thank our principal, Dr. A. Ramesh, for his esteemed support and unwavering leadership to all the staff and students of VIPER. Thank you, sir. I thank the coordinator team of Aushadh 2K25 for their tireless efforts in making this event and executing it in a systematic way. Thank you. I thank all the staff of VIPER, teaching staff, teaching faculty, and technical team of DBRIT and VIPER for covering and keeping their effort throughout the event. Thank you. I thank the print and press media for covering the whole event and spreading its success throughout. Thank you. I thank all the students of VIPER, student volunteers, artists who performed today morning and making this event graceful. Thank you. And finally, my enormous thanks to all the delegates for their enthusiastic participation in the event and making it a huge success. Thanks to one and all making this VIPER vibrant. Thank you all.
Thank you so much, ma'am.
It's time for the refreshment break. Please enjoy tea, snacks beside the auditorium. We'll resume our session.
Please enter to auditorium in 15 minutes. I request everyone to enjoy the good refreshments that are provided beside the auditorium. Volunteers, please guide the delegates. I request the volunteers to guide delegates towards the refreshments. Please be in the auditorium within 15 minutes.
ఇట్లా పోతే తెలుస్తుంది చూసే పేరుందా మనకు తాగిపోయి ఇక్కడ రావు
I request everyone to be back in the auditorium within 15 minutes. Thank
పోయా
you.
పోకు మన జనాలు ఎక్కువైపోతారు
ఫార్వర్డ్ చేస్తున్నాను డైరెక్ట్ ఫార్వర్డ్ చేస్తున్నాను
ఇది వెంకటేశ్వర దగ్గర ఉన్నది
నేను ఓపెన్ చేస్తాను
వెంకటేశ్వర దగ్గర ఉన్నది
ఇదిగోండి ఇది ఓపెన్ చేయండి
వెంకటేశ్వర దగ్గర ఉన్నది చేసుకున్నాం
చేసేసారు నిఖిల్ పాఠక్ రీసెర్చ్ అని ఖచ్చితంగా
చేసిన తాగిరాబో పోయి సార్ ఇది చూడండి సార్ ఇదే
మళ్ళీ మేము చేసిందంట చూడండి
నేను మీ దగ్గర తీసుకున్నా ఇదే మీ
అదే
దగ్గర
అదే
తీసుకున్నా.
ఒకసారి ఆన్ చేసి చూడండి అంతా పర్ఫెక్ట్గా వస్తుంది ఒకసారి
అసలు
చూడండి.
పెట్టవా దానికి వస్తున్నాయి తీసుకున్నా
సార్ అన్ని స్లైడ్స్ ఒకసారి
చూడండి సార్
సార్ ఎన్ని స్లైడ్స్ ఉన్నాయి
27
ఓకే ఓకే
తాగిరా పోపు మళ్ళీ వచ్చేస్తారు. ప్రింట్అవుట్ తెమ్మన్నారు సార్. ఇంకా టీ పెట్టిన స్నాక్స్ పెట్టిన ఎవరన్నా పోయి అందరూ పోయినా ఎందుకు పోయినా నర్సింగ్ సార్ నేను డే టైంలో ఏమో చేస్తాను. డే టైంలో ఫిట్ ఒక లెక్చర్ ఉంది 10 గంటలు, హాఫ్ అన్ అవర్ లెక్చర్ లాస్ట్ తిన్నాక తర్వాత తిన్నాం. ఇప్పుడు ఉంది తినడా, ఇప్పుడు లెక్చర్ ఉంది. చాయ్ తాగి వస్తుంది. టీ బ్రేక్ ఏం చేస్తే అందరూ మనసుకుంటూ ఉంటారు. చూస్తే ఒక్క నుంచి మీకు టైం టేబుల్ పంపిస్తా. టైం టేబుల్ పెడితే సతాయించే కాదు. నువ్వు కరెక్ట్ టైంకి బయటకు పోతుంది. శ్రీసార్కి వచ్చింది బ్రిడ్జ్ పండించాను. అదే పిల్లలు ఢిల్లీ సార్ తెచ్చిపెట్టాను. ఏమన్నా ఫోన్ చేస్తే నంబర్ రాసి వచ్చినా గీత 2 రోజులు 3 రోజులు అవుతుంది. నేను 2 రోజులు ఏదైనా అంటే మీతో మాట్లాడుకుంటుంది. మళ్ళీ సాయంత్రం ఏముంది, రేపు ఏముంది, ఇదేం లేదు. రేపు మధ్యాహ్నం నుంచి రేపు మొత్తం ఇదే అక్కడ చిన్న సెమినార్. యాన్యువల్ డే 4 తారీఖు ఉంటే క్యాన్సిల్ చేసింది. మళ్ళీ 16, 18 అంటున్నాడు. 16, 18 ఉన్నదన్నాడు, ఉంటే చెప్తున్నాడు. యాన్యువల్ డేకు అవసరం, యాన్యువల్ డేకి ఎప్పుడు పెట్టలేము కదా. ఈసారి పెడతారు. పెడితే నీకే చెప్తాను, ఇంకెవరు చెప్తారు, ఎవరు చెప్తారు. ఫోటోగ్రాఫర్ వేస్తుంది. అప్పుడు సాక్షి చేసిన మళ్ళీ ఇంకో ప్రమోషన్ ముందుగా ఈనాడు, మళ్ళీ అందరూ సాక్షి ఉండదు. ముందు ఈటీవీ, తర్వాత సాక్షి, మళ్ళీ ఈనాడు. కూర్చొని 2-3 ఫోటోలు తీసుకో కూర్చొని బయట.